Irina, I mean, what is chronic care management? So I'm sitting here thinking, I wanted to get a job outside of the hospital system, and it's not really working for me. But I don't really know what this chronic care management thing is. I'm not a chronic care management nurse, whatever that means. How do I even get involved in something like this?
Another excellent question. So chronic care management was really designed by Medicare a few years ago when physicians and nurse practitioners said, we are not getting paid for time that we spent on the phone outside of the office visit. So Medicare said, okay, well, we're going to implement few new CPT codes. We're going to call it chronic care management, and you can bill us for everything you do in between your office visits. So truly, it's the program that Medicare has designed and is reimbursing physicians and nurse practitioners for. So as a nurse, you would have to find a doctor or nurse practitioner with their own patient population, with a panel, and help them manage the patients. And then that physician will bill for the work that you are doing and will pay you for give you a portion from all the stuff that you do. But basically, in order for a patient to qualify, they have to have Medicare, and they have to have 2 or more chronic conditions. When you think about Medicare population, about 70% of people have 2 or more chronic conditions, and they all have Medicare after they're 65. So in reality, it's pretty much everybody that has Medicare can qualify for it. In terms of provider, doctor has to have a few different things like, EHR and provide 24/7 care, which they already do, and then doctor can participate. So it's really easy, and it's not, let's say, a program where, we had nurses who have never worked in maybe chronic care, like they worked in the OR or they worked in ER, really acute care. It's not anything that we as nurses don't know what to do. It's really calling patients, connecting with them, and really understanding what their barriers are. And it's not about teaching somebody maybe about diabetes, because we all know that patients know, they've been taught 100 times what to do, what not to eat, and what medication to take. But it's maybe finding out, do they have a transportation to go see their doctor? Do they have money to pay for their insulin? And if they don't, maybe they need something cheaper. So this is really kind of what chronic care management is. And it's every activity. This is first time, Catie, in my career that we as nurses can bill for every minute that was spent with patients. Whereas before, you do something with the patient, and then you have to take your time and document it. And then you might need to make another phone call. And people always feel like they're overworked and underpaid. But this is where literally every minute that you do is billable.